Imagine undergoing brain surgery without anaesthetic, modern instruments, or even a clear understanding of how the brain works. Yet for thousands of years, people around the world performed a procedure known as trepanation. Trepanation is the practice of creating a hole in the skull by scraping, cutting, or drilling through the bone. It's one of the oldest known surgical procedures in human history. Archaeological evidence suggests that practitioners used sharpened stone tools made from flint, obsidian, and other hard materials. In later societies, bronze and iron instruments were also employed. Archaeological evidence indicates that trepanation was being performed as early as 7000 BCE, making it thousands of years older than many ancient civilizations. Trepan skulls have been discovered across Europe, Africa, Asia, and the Americas, suggesting that the procedure developed independently in numerous cultures. Why people performed trepanation remains a subject of debate. In some cases, it was likely used to treat head injuries. By removing damaged bone fragments or relieving pressure caused by bleeding inside the skull, the procedure may have helped some patients survive serious trauma. However, many trepan skulls show no sign of injury, suggesting other reasons for the practice. Some historians believe that it may have been used to treat headaches, seizures, epilepsy, or mental illness. Others argued that it served a religious or spiritual purpose, with the opening in the skull intended to release evil spirits believed to be causing disease. The evidence of success for trepanation is particularly striking. Many trepan skulls from around the world show clear signs of healing around the edges of the opening, indicating that the patients survived not only the operation itself, but often lived for months or even years afterwards. One notable example comes from the Inca civilization of Peru, which flourished in South America between the 13th and 16th century. Archaeologists have discovered hundreds of trepan skulls from the region, many displaying extensive healing. Researchers believe Inca surgeons developed highly refined techniques, often carefully scraping away the section of skull rather than cutting deeply into the bone, thereby reducing the risk of damaging the brain. Some studies have estimated survival rates of around 70% during certain periods, an impressive achievement considering the absence of modern anaesthetics, antibiotics, and surgical equipment. Trepanation continued to be practiced in parts of the world throughout the Middle Ages and in some regions into the modern times. Although it is no longer performed for spiritual reasons, modern neurosurgery occasionally uses related procedures to relieve pressure on the brain following severe injuries or strokes. Today, trepanation offers a fascinating glimpse into the ingenuity of ancient medicine. While early practitioners did not understand the brain as we do today, their willingness to perform complex surgery demonstrates a remarkable attempt to treat serious illness and injury using the knowledge available to them at the time.